Thank you for joining me today. In this video, you will learn Bupropion. I have a case study based on Bupropion, and you will learn more about Bupropion. So, a 29 years old female presented to the outpatient clinic, and she reported persistent depressive symptoms over the past 5 months. Over the past 5 months, she had a depressive mood. She works a sedentary lifestyle, office position, and she reported increased difficulty maintaining a motivation and focus at work. Past medical history is a significant to past medical history is a significant for mild obesity. She has no history of a seizure. She has no history of eating disorder or psychiatric hospitalization. Her family history is notable for depression. Her father. She does not smoke, she does not drink, and she denies illicit drugs. She's not pregnant. And the symptoms she is presenting with are low mood most of the day, fatigue and low energy, decreased motivation and productivity, difficulty concentration, hypersomnia on the weekends, so she's awake in the weekends, increased appetite and weight gain. She denies suicidal ideation, psychosis, manic episode or manic symptoms, mental status exam revealed a comparative patient with depressive mood, intact cognition, so her cognition is intact, linear thoughts process, and good insight and judgment. After you assist her with PQ9, it indicated she has a moderate major depression disorder. So clinical assessment, the patient needs DSM-5 criteria for major depressive disorder of moderate to severe, with promote neurovegetative symptoms include low energy, hypersomnia, impaired concentration, weight gain. Given her symptoms and profile and concern about the weight changes and sedation, medication selection focus on activity and weight gain neutral options. So since she's already gaining weight, you want to choose medication that is not increasing her weight. So Bupropion was selected because Bupropion is effective for treating major depression. It has active profile, benefit for low energy and impaired concentration. So it will improve her mood and it will improve her concentration without increasing her weight or appetite. Mild side effect, it has a mild side effect compared to SSRIs, Bupropions. Typically, normal weight associated with mild weight loss. So this medication is no serotonergic activity and has a low risk of sexual dysfunction, emotional burden. The patient has no contraindications such as seizure disorder or eating disorder. Because if the patient has an eating disorder or seizure disorder, this medication is contraindicated. If the patient already has an eating disorder, it will lower their weight and appetite. So after shared decision making to initiate a Bupropion for once a day dosage and improve adhesiveness, you want to educate the patient about medication purpose. You want to educate the patient instead of the action and treatment of the medication. You want to educate the side effects and safety consideration and important warnings. So this medication, the reason you choose this medication is an anti-depression medication that works on dopamine and neuroreferral. So it works both neuroreferral and dopamine pathways to improve mood, energy, and concentration. Initial importantly, it may take 2 to 4 weeks to be effective, and it will be full effective in 6 to 8 weeks. Some of the side effects include dry mouth, headache, insomnia, anxiety, chilliness. Safety consideration is take this medication in the morning to reduce insomnia, because this medication will increase your energy and so it's like a coffee, so it will increase the alertness. It will cause you insomnia if you take bedtime. So take it in the morning. Avoid, that's what you teach the patient. Avoid this abrupt dosage increase. You cannot increase the dose without your provider present. That's what you educate the patient about. Limit the alcohol consumption because that can lead to seizure. If you combine alcohol with this medication, there is a risk of seizure. You will increase the seizure threshold. An important warning will be report new or worsening anxiety, agitation, or change in mood. Do not crash or split this medication. You wanted the patient to verbalize understanding and agree to the treatment plan before they leave or before you discharge them. You want to monitor them. You want to monitor depression symptoms If the QHB9 is improving, the score is getting lower. If their energy is improving, motivation improving, concentration is improving, anxiety or irritability is getting less, sleeping better, no insomnia. You want to also check their blood pressure. It can cause mild increase of blood pressure. Bupropion can increase the blood pressure. That's one of the side effects. No routine lab monitoring for healthy adult. Baseline lab defined due to absence of a combined or comorbidity conditions. If the patient don't have other comorbidity conditions, there is no reason to check their labs by taking this medication. If they are, you want to test them though. You want to test them if they are pregnant as a clinical indicated. The treatment outcome that you are hoping to achieve will be, you will have a follow-up appointment with the patient within 6 months, within 6 weeks, within 6 weeks. You want to see after that 6 weeks, you want to see improved mood and emotional resilience. You want to see increased daily energy and concentration. You want to see improved work performance. You want to see a decreased hypersomnia, decreased fatigue, decreased depression. Those are what you want to see. Also, you wanted them to report that no side effects, no weight gain, no insomnia. So you want to see that effective. If you, after the 6 weeks, if the medication works the way it's supposed to work, and if the patient is feeling better, you can continue at the current therapeutic dosage. Encourage a behavior activation, encourage them to exercise, and refer them therapy. You want to reassess the mood, sleep, and blood pressure within 6 months. Plan to continue antidepressant therapy for at least 6 to 12 months. It takes a long time for depression medication to work. So it takes 6 to 12 months to be effective. You wanted them continue, but you want to monitor them every 6 weeks. You want to have appointment if they are still taking the medication, if they have a side effects, if you want to increase or decrease the dosage. You want to instruct the patient to return sooner than the 6 weeks if their mood gets worse, if they are anxious, if they have a side effects. So, as we mentioned before, this medication is antidepressant. You will take for antidepressant, and it's indicated for FDA for major depression disorder, seasonal affective disorder, smoking cessation. Some people take it for smoking cessation, and it will help with the stop the smoking. It will lower the craving. It will help with the craving. Common off-label usage for this medication is ADHD, sexual dysfunction, bipolar depression. Those are off-label use. It's not approved for FDA, but some people use for that. Some provider prescribe the medication for that. Expected benefit, symptoms improvement is a typically not immediate. It takes 4 weeks, 2 to 4 weeks at least, and full recovery will be 4 to 6 weeks. You will take the same day, every day at the same day. Do not take this medication close to the bedtime. As we mentioned before, it's good to take it in the morning. Don't crash or chew the medication. Do not double the dose without your provider present. He will do that. The provider will either decrease or increase slowly if he needs to or she needs to, but you cannot do that without prescription. Common side effects include agitation, insomnia, anxiety, headache, nausea, vomiting, tremors, heart palpitation, dry mouth, weight loss, decreased appetite. It increased constipation, dizziness, abdominal pain, tinnitus, and sweat. So all these side effects, you have to report them, or you will educate the patient to report them. Practical management tips will be insomnia. Take dosage early in the day to keep the dose as lower. If you feel you are having insomnia, take the medication early in the morning and take it lower dose. You will prescribe lower dose and you will avoid late dosage. For dry mouth, constipation, and nausea, these are listed as knowable effects and many side effects may lessen with time. So those will come. GI symptoms will come less when the patient uses the medication more time. Serious side effects include suicidal thoughts. There's a warning. FDA labeling highlights increased risk of suicidal thoughts and behavior for teenagers and children and young adults, and it recommended close monitoring for worsening or emergency if these symptoms are present. You want to discontinue the medication and switch to other medications if those are happening. And you want to educate the patient to come or call the clinic quickly and monitor the symptoms to report quickly. You want to teach the family and the patient for the urgency of reporting these symptoms. It also has a risk of seizure, and if you discontinue the medication quickly, it can increase the risk of seizure. Also, it has neuropsychiatric advice event during the smoke cessation. So FDA labeling noticed that post-marketing report of a series of clinical significant neuropsychiatric events like mood changes, depression, manic, psychosis, hallucination, agitation. Those are risky of taking this medication or discontinue this medication. You want to start it slow and see how this medication treat the symptoms you want it to treat without creating more issues. There is also allergic reaction, which is rare, but it has allergic reaction. Some of the contraindication of this medication: do not use this medication if you have a seizure disorder, if you have a bulimia or eating disorder. Do not discontinue or do not use this medication with alcohol, benzodiazepine, barbital, anti-epileptic medication, anti-seizure medication, or MAOI usage. Don't take those medications with this medication. That is contraindications. If you are taking MAOIs, it has to be 14 days between them. Thank you for joining me today. I would love to see you in my next video. Please subscribe. Thank you.